Welcome to City Vibes Metro. I'm your host, Christina Andrianopoulos, and I am pleased to present the newest lifestyle program in Worcester County on Charter TV3. This week's episode, in the health and fitness segment, we have the pleasure to have as our guest Dr. Stan Levenson. He's a renowned dentist who specializes in cosmetic dentistry. He will talk about studies that indicate a direct link between periodontal gum disease and heart disease. In our style and fashion segment, I have the great pleasure to introduce interior designer Denise Pierce, who will talk about how to create balance within your space, and she'll take some of the mystery out of feng shui. And in our vibe segment, we have the great pleasure to speak with two wonderful women who are instrumental in finding the Worcester chapter of Dress for Success, an organization that helps disadvantaged women transition into the workforce. We'll be speaking to Kathy Barron and Sharon Woodbury. And it gives me great pleasure to announce that Commerce Bank, the bank you should know, is our program sponsor. Don't go away, and we'll be right back.
Retirement? What's that? These are the best times of my life. I worked hard for them. That's why I joined the Commerce Bank Royal 50s Club. I get special rates on my CDs, discounts on shopping and travel. I get my own personal banker.
Plus, no fee checking, unlimited ATM access, free online banking, and free online bill pay. The Commerce Bank Royal 50s Club, helping you make the most of your retirement years.
Wake up, Worcester! I'm Hank Stoltz, inviting you to join me every Tuesday and Thursday morning at 8 as we meet with the newsmakers about the day's top stories and bring you up to date on great events happening in the area. I can walk out and feel pretty good about them. You kind of were able to infuse this can-do spirit. Worcester has probably grown up enough. So up and at 'em, everyone. Let Wake Up Worcester get you out the door Tuesday and Thursday mornings, well-informed with a smile on your face. Wake Up Worcester, only on your hometown station, Charter TV3.
Welcome back. We have the great pleasure of meeting Dr. Stan Levenson. Stan, I'm going to call you Stan because I know you pretty well. You have a practice in Worcester, and one of the things that you're known about is creating unforgettable smiles. Why don't you tell us a little bit about yourself and your practice?
Well, first of all, Christina, thank you for having me on this special segment today. We do enjoy, in fact, I enjoy doing cosmetic dentistry, probably above all else in the past 20 years. You know, one of the things people notice first about you is your smile. They say it helps you get people with good smiles to have an opportunity to get better jobs, meet people. And I know when I smile at somebody and they smile back, it makes both of us feel good. So there's a certain emotional as well as physical effect that I think having a pretty smile impacts on people.
Also, when you see someone and you meet them, one of the worst things, it might be an attractive person, the worst thing is when they smile and they have really yellow teeth. So, I mean, you take care of that, right?
I would say so. In fact, when I have patients that do come in for cosmetic consultations, they may be impeccably dressed, beautifully done hair, and when they smile, it's just, it's sort of a disappointment for them as well as for me, and I do the best I can to create that smile that they will be able to enjoy for many years. There's a lot of ways we do improve people's smile. Most people are familiar with teeth whitening. That's a relatively inexpensive way to brighten your smile. Works very well on healthy enamel, and doesn't work at all, unfortunately, on crowns or caps or dental products. So for those people, they have to get more involved in trying to recreate smiles utilizing porcelain laminate veneers or crowns or those type of things. And we're very lucky in our profession, my profession today, to be able to do great things for people and improve their appearance.
Oh, you know, many of us have terrible opinions of going to the dentist, but going to somebody who really fixes up your smile must be a really fun thing. And so, and you're right, this day and age, people should take pride in their smiles, and does it like sort of take some age away from you too?
Well, it's interesting. You know, one thing I will say is that going to the dentist, and I can speak for myself as well as my colleagues, is not what it was for many of us that grew up in the 50s, 60s, and even the 70s. In my office, for instance, we have homemade cookies, bottled water. We have warm neck wraps for people. We make it hopefully that people can look forward to their visit with us.
That's great.
Well,
neck wraps, and I'm coming. I'm going to book an appointment. And a great smile. You leave with a great smile.
Right. Well,
yeah.
So the technology has changed all for the better. That's as it is in other medical fields, and we're able to do a lot for people and concentrate on, as I said, their smile as well as other health issues.
Right. Talking about other health issues, one of the areas that I wanted you to talk about is there's a direct relationship to, or studies have proven, with periodontal disease and heart disease. And my friend in New York, she goes crazy about flossing. She goes, "Oh, I'm preventing my heart disease." So could you talk a little bit about that?
Well, it's interesting. For years you'd go to the dentist, get your teeth cleaned, and the hygienist would say, you need to brush and floss. You'd shake your head, oh sure. You'd leave, you'd floss for a day or two, and then you'd stop. Well, now we have a good reason to do that. Research today, and a lot of it's very current, and it's probably some of the most impactful studies that have come out in cardiovascular research recently, is the implication of something called a statin, which is directly linked to cardiovascular disease. There's also another product called C-reactive protein. C-reactive protein is found in elevated levels in people that have gum disease. So there appears from this research to be direct linkages between gum disease and cardiovascular risk. In fact, people that have gum disease that isn't being treated are a very high risk. And again, it's not considered one of those things you think about. You think about obesity, you think about smoking, you think about a sedentary lifestyle. You don't think about flossing.
No, that's true. Wow.
So good oral hygiene, taking care to resolve some gum issues is really, really important in your overall health. And I think we're trying to focus on our patients, looking at it as the mouth is just one part of your body and everything is interconnected. And I think if we tell people brush and floss because you may be at high risk for developing heart disease, I think we're going to have more people brushing and flossing properly.
Yep, I'm going home to floss. I'm going to do it. And furthermore, people who have gum disease must take antibiotics as a preventive measure when they come to a dentist. Isn't that the case as well?
That's not true anymore. We are a society where we've overdone it with antibiotics. There's a lot of resistance. There were a lot of people that would take prophylactic or preventative antibiotics to prevent something called endocarditis. The American Heart Association, as recently as about a year and a half ago, came up with new guidelines. So people that maybe didn't want to go to the dentist because they had to take antibiotics before they're cleaning, don't have to worry about that precaution in most circumstances. And of course, you check with your physician and your dentist to see if you need to. But we have other more modern therapies to treat gum disease as well as medication.
That's great. Now, your practice is here in Worcester, so why don't you tell our guests, we can see your website, so tell our viewers where your practice is.
Well, I've been in the same location for over 15 years, which is 9 Linden Street, near downtown between Pleasant and Elm Street. I share a building with another dental office, an oral surgeon office, and we have a very nice space, modern, comfortable. You'll see pictures of it on the website. Free parking.
That's great.
And I've had some of the same team with me for many, many years. So a lot of the patients that come back for cleanings and checkups see the same faces each time they come in, which makes it somewhat like a family. And
it's also great to proclaim that you create unforgettable smiles, which is great. And also the information about periodontal disease will pop up. I've got the website coming up so they can learn, our viewers can learn a lot more about the linkage between gum disease and heart disease. Stan, thank you so much. Thank your staff. Thank your lovely wife, Debbie, too, who facilitated this. And we'll see you again.
Well, thank you for having me. It was a pleasure to be here today.
Great. Thanks. We'll take a short break and be right back. That was great.